Hey guys, Emmy here. The case study I chose to discuss today is called One Small Cut That Killed. Just a little background. It involves a primary care physician and her patient Joe. He's a farmer and he comes into the clinic after he has a fall in the chicken coop. Results in swelling and pain in his right ankle, along with some cuts and bruises on both of his legs. He appears to be fine otherwise, so the doctor instructs him to purchase an air cast, take some ibuprofen, and rest, and she sends him home. And continues on with her day. 3 days later, Joe's admitted to the ER with low blood pressure, fever, extreme shaking, an irregular heartbeat, and agitation. It's noted by the ER nurse that a cut on his left leg is infected. Joe continues to worsen and eventually goes into septic shock. After 2 days in the ICU, he dies of complete organ failure. All the family knows at this point is that he came in with a small cut and suddenly died. They're confused and they want answers. The hospital is pressuring the primary care provider to apologize in hopes of avoiding legal trouble, but the doctor is scared that if she admits there's any chance she made a mistake, she'll be in bigger trouble professionally and legally. She's also worried about what her colleagues and patients will think if she admits that she made an error. I stand in favor of the primary care doctor talking to the family and admitting fault. I approached this issue using the 6 pillars of character to come to my decision. The 6 pillars include trustworthiness, respect, responsibility, fairness, caring, and citizenship. Trustworthiness is a character that I feel all primary care providers should uphold. By talking with the family and admitting fault, the doctor would be showing honesty, integrity, and loyalty. Speaking with the family would also show respect for them and the patient's life. The family deserves to have their questions answered and to be treated with dignity and common courtesy during such a tough time. Responsibility is another major ethical value that needs to be upheld in this situation. Although there are numerous factors that come into play, it is the right thing for the primary care provider to remain accountable for our actions. By claiming responsibility, the doctor can acknowledge the mistake, grow from it, and better her practice. The ethical pillar of fairness involves pushing one's feelings aside and admitting mistakes promptly, voluntarily, and never taking advantage of vulnerable or ignorant populations. Addressing the family and their concerns and questions would be the fair thing to do. Caring is at the center of ethical principles. The caring thing for the doctor to do in this situation would be to empathize with the family, voice her sorrow, and admit to her mistakes. Lastly, citizenship is an important virtue to consider when making an ethical decision. Citizenship involves civic duties and virtues that shine a light on how we should behave as a community. It's not uncommon for patients to present to the clinic with minor cuts that usually heal without any difficulty or adverse events. In this case, however, the physician could have provided education on infection control, how to properly dress the wounds, importance of keeping the wounds covered, and hand washing. She also could have cleaned and bandaged the cut while in the office, prescribed an antibacterial cream or suggested one over the counter. This could help promote healing and decrease the chances of infection. She also could have educated him on early signs of infection to watch for, so that if the infection were found, it could have been treated in the early stages. By upholding the 6 pillars of character, this doctor would be a positive example of how to accept our mistakes with grace and to grow from them. It has been shown that 2 main reasons for why patients sue are because they feel like they have been wronged or disgraced, and 2, to get answers about what happened. For many patients and/or families, pursuing legal action is the only way in which they can get information regarding what happened. This indicates that liability can be reduced and the dignity of patients and families can be upheld if the physician expresses remorse over the mistake and explains why it happened. Thank you.